So now we've had a discussion about the guidelines. We've had a discussion about pre-agreements, about planning where to present and publish. And so now I'm going to talk about the actual, in the old-fashioned way, which doesn't happen anymore. I don't actually use a pen anymore, but pen and PowerPoint presentations and publications. And we're going to shift and talk about another partnership that I'm involved in. It's a newer partnership. It's not as formalized as the Greensboro Health Disparities Collaborative. I work with this Strengthening the Black Family, which is a 30-year-old community-based organization in Southeast Raleigh. As its title suggests, it's really all about how can we develop and support the African American community in Southeast Raleigh in particular. Led by an amazing, initiated by an amazing woman partner of Lynn's and Jeannie's, Lucille Webb, who's just a leader in community-based participatory research approaches, nationally recognized, really extraordinary person. And actually, though UNC and Strengthening the Black Family has had a relationship for a long time, this was kind of a new direction for it. And actually Melvin Jackson, who is the program director there and involved in a lot of different things, both in the community and in the university, came to me and asked me to be involved with it too. So luckily, this also started from a community-driven approach. So just to give you a little sense, we don't have a formalized mission either the way the collaborative does. But really what this was about was trying to address HIV disparities among African American youth in Southeast Raleigh. And Strengthening the Black Family had run a project for many years called Teens Against AIDS, which was a peer education program, and lost their funding at one point, which is again why Melvin came to me, because he saw an opportunity out of the Carolina Comprehensive National Institute for Minority Health Disparities Center that used to be here, for a little bit of pilot funding that was asked to use a CBPR approach, also to link up with a really interesting church network that was involved in doing research, African American Church Network. And so he had also, Strengthening the Black Family had also identified a new curriculum for working with African American youth ages 12 to 15 called Focus on Youth Plus Impact. And it was a way to build knowledge, but also strategies to help youth, become better decision makers, increase parental communication, all sorts of things to lay a foundation for HIV prevention. And Strengthening the Black Family and the Teens Against AIDS project had not been able to reach into African American churches. African American churches weren't enthusiastic about talking about HIV prevention and sex, in the church. But because of this church network that UNC had, it was surmised that some churches might be interested in doing some kind of HIV prevention. And so we reached out to several churches to test this HIV prevention intervention in their settings. So that's kind of the background to all of this. We're now actually working in public housing communities too. But the strategy, and it's really kind of about different things that we did and how this CBPR approach is an iterative process and a way to continue to find resources to respond to community needs. And so we did put together a community advisory board, which is really important because they met monthly to help us think about, well, how do we get into the churches? So we had faith leaders on that community advisory board who thought it was great that we wanted to go into churches to talk about HIV prevention, and others who said, no way, not in my house. Remember that, because that'll come up in a minute. And then we also, the intervention asks you to do focus groups to make sure that your intervention is appropriate for the community where you're working. We did them with both youth and adults. And one of the things that came out was that the intervention focused on really important things, but it didn't look at the social and environmental factors that impact why African American youth are at risk for HIV. And so again, in a responsive way, which is what CBPR allows you to do, we were able to say, well, gosh, let's think if we can address, some of that and try to understand those factors. And so then we implemented a Photo Voice project, and I'll talk a little bit more about that in a second. And then the Photo Voice project brought out other issues and ideas about how we could address that. And so then we developed a youth-focused program called Youth Empowered Advocating for Health. And all those things are important because they all affect kind of what we did in terms of publications and dissemination and presentations. So I'm going back to the authorship. page, because again, you heard a lot and wonderful things about how we co-generate ideas, co-plan, co-present, and I'm going to talk a little bit more about that, and especially about the authorship piece of it. Jennifer was talking earlier about the fact that there are different people who can be co-authors or can be the lead author, and then you want to involve people in the role for co-authorship. And that sometimes we want to really privilege the doctoral students or postdocs that are working with us, and sometimes it makes more sense for the PI to be the lead, but we always make sure that our community partners are a part of that process. And again, the identification of the lead author is based on the person's interest and willingness to do the work. Criteria for authorship, again, means that you're able to take it on and that you've been really involved in the process. But also, as Jeannie, I think, was saying, that it doesn't mean that you're actually the person sitting at the computer doing that writing. That contribution of ideas is hugely important, and that you take on different roles in the actual writing. So, and you saw the wonderful description of the communities that were done in the Greensboro Health Disparities Collaborative, but figuring out, so you could have committees who were helping to do the draft the initial proposal, but you could have people who were doing some editing, you would have people who were doing, you could also break it up into people who are writing certain sections of the paper as you're going along. So there are lots of different ways to do it, and we're very flexible, but we also, again, really try and talk about this. And finally, the whole acknowledgments piece versus co-authorship. I'm going to give you an example in a moment of that, where you can see where a lot of people wanted to be involved in the actual writing process, but other people didn't want to be involved in the writing process, but they were critical to the project, and so we acknowledge them in the authorship. So I'm now going to give you a couple of examples of how we have co-developed. So again, I was giving you a little introduction to the project, talking about kind of what the goals and what the strategies of this Focus on Youth project. So again, it was really important, just the way it was for the Greensboro Health Disparities Collaborative and the C-CARES project, to disseminate in both community forum areas, community and academic. And so all the way through, we did that. And again, I'm going to give you some more specific examples about that. One other unique piece of this is that, in fact, I was just yesterday working on a paper that we're about to get out that's about involving youth in this whole process too. So it's youth are our community partners, and their movement from being advisors on the community advisory board to actually being now co-writers of this publication that we're sending into for a peer-reviewed journal. And in the middle of that, learning how to present, how to do this at both local and national conferences. And in fact, this picture on the right, it's a little dark right here, but it's actually standing right in front of this screen a few years ago for one of these seminars where we had, let's see, on your left, Linda Riggins, who is one of the community partners from Strengthen the Black Family. In the middle is one of our postdocs, a different postdoc from the Kellogg Health Scholar Program. And on your right is William Riggins, who co-presented in this presentation in this room, which is very exciting. So nuts and bolts. How do you do this? Because it's challenging. It takes a lot of time. How did we first starting with just presentations? Because presentations are often the initial the road to publications. Bless you. So meet with partners to brainstorm ideas. Decide where you want to submit your abstracts, what the focus of the presentation will be, decide, again, on the lead author or co-authors, who wants to be part of this and really contribute ideas and create PowerPoint slides, write the notes for the presentation and all of that. Often what we do is the lead author will kind of corral all those ideas and write up an abstract and then send it out for additional feedback from the co-authors. We're a less formal partnership, so we don't have a publications committee we have to send it to. We just send it around to all of our partners in all of this. We revise the drafts collaboratively until everyone agrees that they look the way they want. Everyone wants it to look. We submit and wait. It all involves a lot of waiting, whether it's abstracts or publications. If accepted, we meet multiple times, both in preferably in person, and as much as possible in person, but right now our postdoc, who you saw right there, Brianna, has a faculty position out at Iowa. And we still are co-presenting and co-publishing and co-drafting, and we have to do it all by conference call, but it works. And then the big thing is, practice, practice, practice. So this is a wonderful picture of some of our youth, because our youth have had amazing opportunities to speak locally, but also to go to the American Public Health Association conference, which is, the premier public health conference. For the last 3 years, we've been able to get funding for them to go and co-present. And so here they are. This is not 2013, it was 2012, practicing before they go up in front of a room like this and talk to adult peers. And then we always present collaboratively. So these 4 were all going to present this publication. So again, church presentations. And again, these are, community presentations. So first, in the same way that CCARES did, presenting it to the findings to the women who participated. We presented our findings, our preliminary findings in the church context to really get feedback about what we were learning about how this intervention was, what the impact was in the church, but also we were trying to do adaptations to make it more appropriate for church settings, and so to get feedback and member checking from the church people about that. And then also I talked about the Photo Voice project. So Photo Voice is this qualitative research method where you give cameras to people in communities to identify their concerns, to work towards what can we do about this, what action steps can we take out of what we learned through this Photo Voice. So we had youth who did this around the HIV risk for African American youth, and they also designed and presented this amazing community forum. There were 100 people there, and you can see some of the pictures of the youth there too. Academic presentations again, locally at the UNC Minority Health Conference. Some of you were there. And one of the youth actually got to present introduce the keynote speaker, which was really extraordinary. And then this one on the top right is another one of the youth actually presenting this poster talking to people. And again, we talked about the American Public Health Association conference, and that picture is of them actually presenting, their work. So I said a moment ago that really presentations are a great way to get your ideas together for your future publications. So how do you do that? How do you, take it from the presentation idea, from that small little 250-word abstract into the actual peer-reviewed journal? Again, we meet with partners to brainstorm ideas. The picture up there is of a presentation we did at APHA called the C Word. I can't remember exactly what the title is, but again, it was about how do you do this intervention in African American church settings, and it morphed into a presentation. You decide on the author. You identify the journal, because some journals are really friendly to CBPR approaches, and others will say, you can only have 2 authors or 6 authors or whatever it may be, and often we have many more than that in our publications, so we really want to think about which journal you want to go to. Again, you kind of draft the outlines, solicit the feedback. Again, multiple meetings. This is labor-intensive work, time-intensive work. Multiple meetings, multiple drafts. And again, there are different ways you can structure the writing process and make sure that everyone can contribute. And I'll talk about that in a second. And again, distinguishing between authorship and acknowledgments. And again, you spend a lot of time revising and revising and revising, and then finally you submit, and then you wait again. So just to give you an example, and this is from a different project, where it was really important for us that a doctoral student got the opportunity to write this paper. We had a really short deadline. We were trying to get into a special issue, so we had to just move at a really fast pace. And yet at the same time, there were a lot of people who really wanted to be involved in this. It was very efficient. We had multiple phone calls about this. But you'll see in here this the co-authorship. So Kristen Black was the doctoral student. She led the entire process, but she got a lot of writing help from Christina Hardy, Molly, and myself. So we're the, and I guess I was the project director, so I'm kind of the senior author on this. But you notice everybody else was really important, both academic investigators like Jeannie, and then also community experts, community partners who are really involved in providing technical assistance about CBPR are in here. But everybody's listed alphabetically after the major writer contributors and before I guess, as a senior author. So that's one way we decided to do it here, and it's often a good way. But then also I'm going to give you a sense of this is what we did in the acknowledgements, because not all our community experts wanted to be part of the writing process. So several of them, David Caldwell, Arlinda Ellison, Tony Locklear, Melvin Mohammed, Naima Mohammed, Florence Iman, and Shanetta Washington, they were all community experts who were part of the whole project and creating the ideas and all of that, but they didn't want to be part of the writing process. And we have other people in the room who got acknowledgements too. And so finally, what did we do? You know, we were able to, again, in a very short amount of time, I'm looking at this just thinking, wow, we've done really well. Because that C-word presentation became in my house, and which really talked about the process of working in church settings with this HIV prevention. The church forums came into, actually that just got published today. I got an email today that Where is the Faith, which is about the adaptation process around how can we make this intervention more friendly for African American settings. We've had 2 photo voice papers, one that has been published and one that was just submitted the other day, and then an offshoot one too, but that's a little different. And then we are, right now, the thing that I was editing yesterday is this paper that's actually involving the youth in writing the paper, and it's going to go, again, to a special issue about youth involved in CBPR approaches. So a lot going on, and it's really a wonderful process. Any questions?